Hey, what's up? I'm Dr. Josh Satterlee from TrustDrivenCare, and I want to talk today about 5 ways to make your healthcare office more efficient. 5 ways. Number one, you must switch to two-way text messaging. Why two-way text messaging? Well, a study on efficiency of front office workers found out that a trained staff member can handle 60 to 80 text conversations versus about 10 to 12 phone conversations for every hour they work. So think about your poor, frustrated, overworked front desk staff. What do you want them doing? Communicating with 60 to 80 convos or 10 to 12 every hour? Plus, text communication allows us a lot of other options. We can automate things. We can start automations. If I'm texting with you, I can send you a picture to look at. I can send you a link to online book. I can send you a lot of things through text. I can't do that while talking to you on the phone. It just doesn't work as well. So encourage your staff and encourage your office to switch to text messaging. And I always say this, there was a recent study done that looked in 2020 that looked at all the medical research that had been done around text messaging. And guess what? 72% of all the studies pointed to positive health outcomes when you incorporate SMS or text messaging. 72% of them said, this is a positive thing we should be using. And I always ask people, what do you use with your family? What do you use with your loved ones? What do you use with your spouse? It's always text messaging, text messaging, text messaging. So why is it any different with your patients? So you want to make your office more efficient? Switch to text messaging. All right. The number two way to make your healthcare clinic much more efficient is train your new clients to be perfect patients. All right. What does that mean? Well, remember, we got to switch to text messaging. But if you train these people, your office will be more efficient because you won't have all the mistakes that drive me nuts as a provider. If there's one thing I hate, it's when new patients show up late and they haven't completed their new patient paperwork. Oftentimes when we ask them, why don't you have your paperwork? They say, I never got the email. That's why you got to switch to text message and make sure they confirm they received it. Now, if that's the case, it reduces the workload of everybody in the office. I, as a provider, don't have to stay late. My front desk staff doesn't have to stay late. When we're not scrambling to figure out, do we want them to do the paperwork now and push Mrs. Johnson, or do you want them to treat Mrs. Johnson right now and do the new patient later? Forget all that. Train your new patients to be perfect patients as they come in. Make sure you communicate before their first visit with maybe what to wear, where to park, maybe what to bring with them. Do you need a driver's license? Do you need their insurance card? Or I work with golfers all the time and I need them to bring a 6-iron and a driver because we're going to do an assessment that uses both those clubs, but also tell them what will happen. And there was a study done in the UK all about no-shows and what really changed them. And what the intervention arm of that study showed is if you incorporate just sending out one text message, the no-show rate goes from 8.4%, nearly 10% of people, all the way down to 4.2%, meaning the no-show rate gets cut in half. And if you want to be effective, if you want to provide more care to more people, if you want to treat people doing the method that you believe is going to help them, the most important thing that happens is they need to show up in your clinic. And it makes everything more efficient when you don't have no-shows. So we kind of hit 2 birds with 1 stone there. Train them to be perfect patients. What to wear, what to bring, where to park, what's important, what's going to happen. And also those communications going on before that new patient steps in the door reduces no-shows and creates a longer relationship built on trust so those people complete their care plans. So train your new patients to be perfect. That's number 2 way to be more efficient in practice. All right. The number 3 method for making your healthcare clinic more efficient is this. Realize that new patients are expensive. There was a study on patient fatigue, and it clearly showed that after a doctor gives advice, the next day or the next visit, the patients don't remember more than about 50 to 60%. There was another study done on diabetic clinics where a doctor read off 5 facts on a sheet, read a script, and just 8 hours later, more than 40% of it had been forgotten or misremembered. What does that tell us? We need to remember that new patients need to split up into a day 1 and a day 2. I think the research is clear there. Now, in doing that, we want to do that to honor the patient. They are overwhelmed with emotion. This is the first time they're dealing with a painful condition. This is the 1,000th time you've dealt with that similar painful condition in people. The emotional load is much different. And that serves to fatigue our new patients, but it doesn't really fatigue us anymore because we have a lot of reps at it. So honor them. Realize that new patients are expensive. So do a day 1 and do a day 2. Also, since patients typically forget things and they want to remember so they can get better faster, send a 24-hour later message. Send them a message 24 hours later that cover the big points, maybe 3 to 5 points that you covered in that first visit about what they should do. Sending that and writing it right at the time of their new patient visit and just scheduling it to send out, which is a cool feature in TrustDrivenCare software, by the way. You can schedule that to go out a day later, 8 hours later, whatever you need, reminds them of the information you shared and helps them be a better patient. If they're a better patient, you can be a better doctor. They'll get the care they need. They'll complete their care visit, and you don't have to worry about hustling out to get that next new patient because they're expensive, and this will help keep them longer. All right. So that's our third tip. New patients are expensive. Honor them with a day 2 and a day 3. Take into account their emotional state and help them remember the important things by sending out that 24-hour text message. All right. Number 4, automate every single communication you can. In fact, you'll see at the bottom, create an electronic communication staff member. What is that job of that? It's a robot that never takes a sick day, never forgets, and make sure that we send out all the information that we can, especially that which can be automated. Now, there are things in your office that cannot be automated. As a chiropractor, I can't automate doing spinal manipulation. Can't be automated. But could I send out a picture to you on your birthday saying, hey, happy birthday, Joe, from all of us here at Engage Chiropractic? Yes, I can do that. Do that for every single patient. And then what about major holidays? What about automating certain times you'll be closed or sending out a blast email when you're going to be at a certain event to attract your patients and get to see them? You're doing a community 5K, or maybe you're participating in a half marathon. All those things are great and are great ways for you to communicate with your potential patients, and a lot of them can be automated. The number of tasks that can be automated is unbelievable, but what's important is you don't automate the things that shouldn't be automated. Don't try and automate a hug, as my friend says. So you can automate appointment reminders. You can automate payment reminders. You can automate holiday messages, and you can even automate patient education. As soon as you know that somebody has a specific diagnosis, tag them with it, and all of a sudden, automated communication starts around that. Maybe you want to send messages, texts, emails, videos, open up courses for them, add them to Facebook groups, whatever it is. All those things can be automated if you just build it out. And just like an employee in your office, having this electronic communication employee, they'll get better with more training and more information you feed them. You do it once, they run it forever. That's a great way to make your office much more efficient. All right. It saves time. And in a healthcare clinic, the number one cost is always staff. You can reduce the number of staff members you need by 1 for the cost of like $400 to $500 or $600 a month. It's not much. All right. Like $100 to $150 a week for an employee, again, that never takes a sick day, never forgets, and does an incredible amount of work. And there's no end to how much work they can do. So create that person. Anyways, all right. Tip number 5 on how to make your healthcare clinic much more efficient. And tip number 5 is this: create and record online courses. This can be overstated. Why? We're healthcare providers, and healthcare providers are inherently educators. We want to educate our people on why they have their condition, how to prevent it in the future. What's the long-term significance of this? What do they need to know about it? Lifestyle. So going back to that diabetes study, what are the most important things a diabetes clinic can share? They covered 5 tips about foot health. Now, when that patient gets their first diagnosis of diabetes, they're emotionally confronted and their brain is not storing information as great as it can. So having an online course where they can go back and access the information that you covered in your visit is a great way to help them have better health outcomes and take load of time off your shoulders as a provider. Look, the one thing we struggle with as providers is having enough time. I've never met a provider who wants to spend less time with their patients. Almost everybody wants to spend more time, but we need to make sure we do the things in office that can only be done in office. hands-on care, talking to the patient, consoling them, holding their hand, maybe doing diagnostic tests. But what can we automate at home? Online courses. Now, it's not just for patient education. Imagine if you added some online courses that were pre-appointment information. If there's somebody coming in for a major test or procedure, like even an MRI, what if they got a video showing what that's going to be like? There was a study done called the tonsil to text method, where parents of kids who are undergoing tonsillectomies got a series of 3 messages. The first message was, here's what's going to happen. The second message was, here's what happened on the day of surgery. And the third message was, here are some red flags to look out for. Otherwise, make sure they rest up and recover. Every single parent in that intervention arm, every single parent that received those 3 simple messages about a tonsillectomy said that they really appreciate it and they wish that more doctors would do something similar. That was the parent's invitation to you to record some online courses. Now, with TrustDrivenCare, you can have an unlimited number of courses about anything you want. So don't forget, you could create a course around something you have expertise in and sell it. If you're a chiropractor that works with endurance athletes, maybe you want to put together a nutrition course. If you are a physical therapist that works with specialized in martial artists, maybe you want to have a course for people over the age of 40 who are involved in martial arts and want to stay injury-free. People will pay that. And the great news is that's an upsell for your clinic that doesn't directly involve your time. Once you create it, you could sell it as easily one time as you can 1,000 times or 10,000 times. It's a great source of revenue, and I'm sure there's something where you have amazing expertise in. So create those online courses. Finally, you can use it to establish your niche. Once again, I love working with golfers, and I want to help golfers get rid of low back pain and hit the golf ball further. We can hit the ball further with no pain. Golfers respond to that message. The best thing I can do is put together a couple courses that I could sell or even give away for free to local golf instructors that teach people, here's how to keep your body pain-free, and here's how to train your body in a way to create longer drives. Most golf instructors love that kind of content. Their students love it, and it serves to put me as the niche expert, the expert in golfers with low back pain. So what is the niche you want to go after? Is it pelvic floor health in women? Is it high school football athletes? Is it, like I said before, endurance athletes who are competing in at least half iron or full Ironmans that need some support to not get injured and need to get their race nutrition in line? If you have expertise there, record that course, offer it to them, package it up. It's easy to do with TrustDrivenCare. So those are the 5 ways to make your office more efficient. I'm Dr. Josh Satterlee from TrustDrivenCare. It's a series of tools and software and training that help you communicate with your patients better, run a more efficient office, and serve more people. We want to all make a big impact, and our software and tools and training help you do that. Check us out.